Hello, my name is Dr. Zelenko. I'm a board-certified family practitioner in Muncie and in Monroe. And I'm making this video as a public service announcement about the current situation with the coronavirus. First of all, let me begin with giving everyone a bracha that Mitzvah Shem, everyone in Klal Yisrael should be healthy and no one should suffer from this or any other illness. With that said, Ein Somchin Ela Nes, we're not going to rely on any miracles. I'd like to inform the public about the reality of the situation. No one alive today has ever dealt with what we are about to deal with. The last time the world experienced something like this was in 1918. Was something called the Spanish flu. The Spanish flu killed 20% of the world population, meaning 1 out of 5 people died in the world. So we are now dealing with a virus that has different characteristics and different dangers, which I'd like to explain. So this virus does not affect people equally. It seems to, Baruch Hashem, not kill children. To the best of my knowledge, there have been no children under the age of 9 in the world that have died from this virus. So in that context, the flu is more dangerous. The regular flu, the influenza virus, is more dangerous to children than the coronavirus. The problem with the coronavirus is that its main target are adults of around 60 and above, or people with chronic medical problems such as lung disease, heart disease, immunosuppressed, diabetes. In that population, it seems to kill around 10% of the people that get it. That's 1 out of 10 people. So here are the latest information that we have about this virus. It seems to be 2 or 3 times more contagious than the influenza virus. So that's important because last year in America, we had 40 million people infected with the influenza virus, 40 million. Out of those 40 million, around 50,000 died. Turns out to be a rather small percentage. However, if we do some basic math, you'll see what this means in this context. If 40 million people had the flu, and we assume that this virus is just as contagious as the flu, even though it's even more contagious. But for the sake of analysis, if we say 40 million people get the coronavirus, which is very possible, out of those 40 million, and I'm not sure exactly, but I would say to illustrate this point, that let's say 25% of those 40 million people are 60 years old and above. That means out of those 40 million people that are going to get infected, there are 10 million adults 60 and above. If it kills 1 out of 10, that means we're going to have 1 million people dead in America from the coronavirus in the next few months. That's 1 million people. Now, one of the main reasons so many people are going to die is because we do not have the resources to take care of so many people. In the United States, I believe there are 60,000 or so ICU beds. I also believe that the government also has around 40,000 reserve respirators. So in this country, there seems to be around 100,000 respirators, half of which are anyway being used on a regular basis. So our capability to care for people in respiratory distress from this virus, which is the main problem with it, is extremely limited. In Italy, people are dying now because there's not enough respirators, and decisions are being made between, let's say, a 50-year-old and an 80-year-old. The respirator is given to the 50-year-old because they have more life to live, and the 80-year-old dies. We'd like to avoid these types of situations in America. Now, there's no way of stopping this virus. It's going to go through the country. We are hoping that by taking certain precautions, we can slow down the spread, that not everyone gets sick at once, so that we could spread out the pain, so to speak, and be able to care for more people than if everyone got sick at the same time. Three things are going to help us regarding this virus. Number one, we hope that as the weather gets warmer, that the virus will become less effective. That's because of the warm temperature, the humidity, the increase in UV light, ultraviolet light, seems to, we hope, weaken the virus. That's number one. Number two, there is promise or hope that there'll be a antiviral medication against this virus in the next few months. And also, we hope to have a vaccine available against this virus in the next 6 months. That means for next year, a lot of people are going to have immunity to this virus because they had it before and survived, or they got the vaccine. And even those that do get sick, we should have the medication to treat it. So overall, we should be able to manage it. The problem is now, no one is immune to this virus. We have no medication. We have no vaccine. And we have extremely limited resources to take care of critically ill patients. That is why the government is giving instructions to shut everything down. I'm going to give you my personal opinion with the understanding that it's not practical, but ideally everyone should stay home, should not interact with other people, which means not go to simchas, not go to school, stay away from large crowds of people, not go to shul, not use the mikvah. I know this sounds bizarre and alarmist, but keep in mind, you and me have never seen what's coming, and it is coming. Me personally, I do not send my children to school. I quarantined everyone, including myself, preemptively. And I'm seeing patients remotely. I'm not coming into contact with patients directly because I have lung issues. And it's my strong hope that this video will give you a sense of perspective of what's going on. I hope that the community leaders will listen and even act l'fnei Mashir Sadin, and close the schools. I understand what that means to the parents, but it's better than having thousands of dead Jews that could have been prevented. Again, I give everyone a bracha that no virus or no infection or no machla should ever touch any Yidden, and we should all be healthy and be zeicha to the coming of Mashiach. All the best.